Members of the media, our friends, and those who've been working tirelessly since we put up our efforts to stop COVID-19 from entering our country, and since its entry with our index case presented over 14 months ago up to today, we face enormous challenges. Of course, with the dilapidated physical health infrastructure we have, the weak health capacity we have in our country, something that we've been exposed to in the last 45 years we've been an independent nation. We're faced with this threat that is ever present, or in fact growing by the day, with COVID-19 totally exposing our weak points and our vulnerability. And so this morning's event, or the launch that I will do after my speech, is indeed quite timely in our strategy to ensure our nation rises above the challenges that we face today. The last 1 year has not been easy. COVID-19 is a global pandemic. It's a global crisis that is killing more, and as we speak today, over 3 million people have died from COVID-19. That is something that is concern not only to Papua New Guinea, but all leaders across planet Earth, all economies across planet Earth, and for us, Papua New Guinea, we are also stepping up in the best endeavors we can to ensure we are COVID-19 resistant or prepared to face the possibility of uncontrolled blowout of COVID-19 in our country. Papua New Guinea has felt the pain of COVID-19, but on a relative basis, we've fared much better than most nations on the face of planet Earth. Of course, I pay respect to the 121 lives lost thus far. We remember them as we stand today. It's an indication that it is real. You only have to ask the 11,000 of positive cases who have been tested and found to be COVID positive for them to tell you that it is real and it is not fake. Amidst many different beliefs we have in our country and different viewpoints, there have been also on the other side of the spectrum and debate who tell us that COVID-19 is not real. But as I said, you only have to ask 11,000 who returned positive tests. And amongst them has been some members of parliament. You only have to ask relatives of those who are deceased today, the 121 of them, to know the pain of what COVID-19 can do to lives and families, and also some of its effect on the greater country and our economy. As a result of COVID-19, for instance, we've been able to start our gaming industry, a gaming sector that employs 5,000 Papua New Guineans. This is the real effect of COVID-19 on lives, on work, and on the economy in our country. We cannot relax. And I want to appeal to all our citizens nationwide. There is no time for us to relax in as far as COVID-19 is concerned. It is real, it is here, it is affecting our country, it is affecting our economy from where you are at the community level up to where I sit as head of our government. It is a real threat that must be addressed. And our strategy has remained the same. Vaccination is now available on market, has come in. Vaccination has been part of our strategy from day one. When vaccination is available at the earliest, we will try to have access to vaccination. And at this point in time, let me pay and stand back and thank WHO, I thank Australia government and its people, my colleague, my Christian brother, the Prime Minister of Australia, for their leadership in ensuring that we on the right spot in the international queue to have access to vaccines that is available. And so, on behalf of Papua New Guineans, the 8 to 10 million Papua New Guineans who have in the country, and all the residents of Papua New Guinea, those residents who call PNG home and live and work amongst us, let me step back and say thank you very much to WHO, the entire United Nations family of organizations who bring in support. I thank the Australian government and their people. I thank also Chinese government and their people and others who stepped in to assist us in whatever capacity they have. And in this juncture, the rollout of vaccinations, I thank especially Australia and WHO for ensuring that we in the right place in the queue and for us to have access the first batch of vaccination and now the second batch that is now ready to be rolled out to our essential workers and those who need it the most. So please, Papua New Guineans in the house today, from the media to everyone, why don't you and join me to appreciate and clap and thank those who helped us in the vaccination. We must not relax. As I said, vaccination has been part of our strategy from day one. Our focus last year before the first case has always been defense, defense, and defense. Stopping COVID-19 from coming into our country. But since then, we've had our first case in March last year. Then we went down on an effective 3 months of national isolation strategy to try to curtail and minimize its blowout there and then. We knew from global, from assessments and information we've fed, that vaccinations might take almost a year for it to be available for use. And so stopping it from spreading right across our country has been our immediate strategy. And to some extent, we've been sort of effective in France to stop it. This time last year, we had 10,000 cases on our hand. There was no vaccine yet on the market this time last year. Vaccine was to come on and we were waiting to stop it from spreading. Because for me, as a person, I knew this when the second case appeared in Kokopo, there were no epidemiological link between the first and the second case. That pointed to me that it was present in our community. And we were trying our very best, and to the critics out there, the opposition leader, for goodness sake, for once, get yourself, go to a place where it's COVID positive and see whether you will get COVID or not. It is real. Only then you will appreciate the need to be COVID sensitive. We're not running politics in this effort. The threat is real. We're doing the absolute best under extreme conditions to try to stop it from being spread through the nuclear policy that now must be part of every Papua New Guinean's lifestyle and habit. I repeat, nuclear policy remains relevant. It now must be part of every Papua New Guinean's lifestyle and habit. Simply means that it goes up to this. If you have no need to be in a public place, or outside of your home, or outside of your workplace unnecessarily, stay put wherever you are. COVID-19 spreads from person to person. If you're not in contact with someone who's got COVID-19, then you will not get COVID-19. So the nuclear person remains relevant. Stay put wherever you are. If you're moving in a bus or in a plane or from place to place, wear masks at all times. Stay distant from someone you are in contact with, 2 meters, 3 meters, 1.5 meters, so that you are safe. Your safety individually means that your family is safe, your community is safe, and your nation is safe. And so I thank at this juncture Papua New Guineans who responded to the call of the nuclear passing and living in a COVID-sensitive lifestyle. Your help has ensured that our cases did not blow out in our face, with possible rate of 1 infection to 3. Last year, we could have had 100,000 cases by now. But today, our statistics indicate, and from those that we've tested, that we are tracking at a rate where it can be managed. If individually, we are sensitive to living with COVID-19 sensitivities and the nuclear passing lifestyle. And at a corporate level, we all work together to ensure it is stopped. And today, vaccination is one of our key strategies to ensure people who are vulnerable and people who are exposed every day in their work, especially the frontline health workers, are vaccinated. Of course, and let me say this juncture, it still remains a voluntary basis program. No one will force anyone to take vaccine if you do not want to take vaccine. But with vaccines being made available, especially for those who are exposed, those who are vulnerable, and those who are in the front line, then when you are exposed at workplace, or when you're exposed, or when you contract COVID-19, you stand to not blame anyone but yourself because you choose not to be vaccinated. And so today I'm happy that over 100,000 of vaccine has been brought in by our donor partners now ready to be dispersed throughout our health system in our country, and to ensure those who are in the front line, our health workers, and those who are vulnerable amongst us, and those who will be classified or are classified as essential people in our economy and in our country are vaccinated, and to ensure we keep our country functional at a level that is able to sustain our economy and keep our country alive and vibrant going forward into what is going to be a quite an active 2021 and a very, very active 2022 with the national elections facing us in 2022. I appeal again to our citizens. We've inherited a weak health system, but we're not going to remain blaming the past. We are now trying to, at the national level, invest in creating over new 1,000 ICU beds right across our country, especially in our provincial hospitals. And after this one, I'm going to meet our budget management committee level. The treasurer has been informed, the planning minister, and the finance minister has been informed on the need to unbundle what is in budget to ensure we create new 1,000 ICU beds throughout our country in the next 1 year. Because I know for sure, COVID-19, for instance, is a case in point. We had cousins of COVID-19 in MERS and SARS earlier, but our country did not prepare for COVID-19 or similar disease that might happen as it is happening today. We have to prepare for the future. Our country cannot remain stagnant with 200 ICU beds as we inherited 44 years ago. And so our government has prioritized now, we want to create over 1,000 ICU beds within the next year or two to ensure those who need care and proper hospital care are migrated into a safe bed available for doctor's care and for rest of us who assist in stopping going into the hospital and doctor care if we continue to live in a lifestyle that is conscious of our health and our community's health. So thank you very much for the light at the end of the tunnel in as far as vaccine is concerned. Again, repeating, it is totally your choice to take vaccine or not. Today, for our essential worker, I am totally privileged, and we have vaccines now made available, over 100,000 of them today. I'm going to roll out these slips, get yourself vaccinated. I was privileged to be the first Papua New Guinean to get myself vaccinated. Now, I am a Christian who believe in educated, Christian-based research and science. I repeat, I'm a Christian who believes in educated research and science statistics that gives me ability to make informed decisions. And I make my choice based on research that is available on the market. For instance, the AstraZeneca vaccine that I took the first shot of 40,000 people vaccinated in Europe, only 40 people had blood clot. Now, statistics compel me that vast majority of people who got vaccinated did not face any side effect. 40 out of 40 million, that's 0.01% as far as side effect are concerned. If they take any other drugs, for instance, they could even have this blood clotting. It was bound to happen for them, in my view. I'm not doctor to be talking much on this, but for me, as a statistician myself, 40 out of 40 million with blood clot side effect was statistics good enough for me to get vaccinated in the face of possible exposure to COVID-19 that I faced. And I made my choice, individual choice. I point you out from a note that I was given here. Israel, for instance, in January had the second wave of COVID-19. They were reporting 10,000 new cases every day. Since then, over 60% of Israel have been vaccinated. 2 days ago, they reported 73 people with COVID cases. That's a drastic reduction, reporting over 10,000 cases a day to only 73 cases. 60% of the population is vaccinated. Vaccine is part of our strategy as far as long-term is concerned. For those who feel they need to take vaccine, we will make it available in our medical cells nationwide for people to be vaccinated. You're not compelled to, but please, if you feel you need consular information, find a doctor closest to you. I know in the medical fields there's also a debate going on, and I ask those doctors to be informed better, and instead of operating on the scaremonger side of the spectrum, come to the middle and see what is the upside of vaccinations. And today I'm here to encourage our citizens. It is going to be available. Over 100,000 vaccines now going to be spread. I thank all again for who have been involved to make this momentous occasion possible in our endeavors to stop COVID-19 from being spread. It will be unfair of me not to thank our citizens. In the last year or so, our people have responded. I thank them. In the last 3 months or so, since the second wave hit our country and we embarked on trying to curtail to an isolation strategy and to start this path towards vaccination, our people again have responded. I thank our people for responding to what is a very hard task. You've responded. Our government's duty is to ensure all help that is available, and this is help that is not just found in PNG, but based on global exposure and experiences, and we make vaccines available, creating new beds, and our efforts in COVID-19 will go at this juncture. I'm happy that 100,000 vaccines are now to be rolled out to our country, for especially our old elderly, for those who work in essential services, and for those in the frontline medical sector. God bless each and every one of you. Thank you again, WHO. Thank you, Australia. And thank you, Health Department, Controller, and all for making this event that is worthwhile to the Lord. God bless.